On today's program, best practices in community health leadership training are explored with leaders and participants of the Community Health Leadership Program, a multidisciplinary training program designed to provide professionals with the specific knowledge, experiences, and skills needed to prepare them for leadership roles, promoting and implementing policies and practices that reduce health disparities and advance health equity.
Hello and welcome to another episode of the SHLI Health Leadership Institute Presents. My name is Dr. Adekeye and I'm the Director of the Division of Health Promotion and Disease Prevention at the SHLI Health Leadership Institute at Morehouse School of Medicine. Today we'll be discussing the best practices in community health leadership training. And with me to discuss this important topic are Dr. Divine Ofebu, Program Manager, Division of Health Promotion and Disease Prevention at the SHLI Health Leadership Institute. Welcome.
Thank you.
Ms. Kim Bug, the CEO and founder of Reaching Our Sisters Everywhere, Rose Incorporated, a 2013 graduate of the Community Health Leadership Program. We also have Mayor Ford, City of Tuskegee, Alabama, founder of the World Conference of Mayors, and a 2013 Community Health Leadership Program graduate.
Thank you.
We have Mr. Hopkins, who is the founder of the Phoenix Group Foundation Incorporated, and a 2012 graduate of the program. Before we dive into our discussion for today, I would like our viewers to know a little bit more about the Community Health Leadership Program. It is a program designed to bridge the gap between academic medicine and communities of greatest need by connecting to people who suffer the most from disparities. The goal of this program is to enhance the skills of our community leaders by educating and motivating them to mobilize community groups to change health behavior, to improve environmental health, and to influence policies and practices that support community health. We currently have 4 types of the Community Health Leadership Program. We have the non-intensive Community Health Leadership Program that is designed for people who reside in the state of Georgia. It is a program that incorporates a partnership between community leaders and students in the Masters of Public Health program. We have the Intensive Community Health Leadership Program, which is designed for early to mid-career level community leaders. We have the Executive Community Health Leadership Program, which is designed for advanced career level individuals and executives of organizations that are focused on eliminating health disparities. Our newest Community Health Leadership Program is the Mayors for Healthy Communities Program, which is a program designed specifically for mayors and elected officials around the country. Since the inception of the Community Health Leadership Program at the SHLI Health Leadership Institute in 2010, we have successfully trained over 150 participants from diverse backgrounds across 40 states in the nation. Our alumni have gone ahead and have developed and implemented a variety of community health interventions in their various communities that are aimed at reducing and ultimately eliminating health disparities. We currently have an ongoing application process, and I'd like our viewers to visit our website for more information on the Community Health Leadership Program at www.msm.edu/HPDP.
Thank you, Dr. Adekeye. To our guest panelists, thank you for being here again today.
Thank you.
Thank you.
Now, as part of your experience in the Community Health Leadership Program, can you discuss 2 important topics or components you've learned while you were in the Community Health Leadership Program?
Ladies first.
Okay, thank you, Mayor Ford. Two of the things that stand out the most to me is as I give, and also as I learn to teach. It's important when giving back to the community and working with the community that we just not take out of the community, and in order to make a change, we need to make sure that we invest back.
Well, I already knew it, but now I really know it since I've attended the Morehouse School of Medicine, SHLI Leadership Institute, that those of us who are elected officials, we really need to take a leadership role. Mayors must become advocates. We must be the first to be tested. We must preach prevention. We must take that leadership role. So I learned and relearned how important the role of elected officials, what our role is, and how we can really help our community. Right. Then I learned what to say and how to say things, because Dr. Satcher always states, we need leaders who know what to say, how to say it, and to make sure they have the facts. So thank you, Morehouse School of Medicine, for equipping me as an elected official to be more effective in providing leadership on healthcare issues in my community.
Okay, thank you.
And the two things that I learned most were being able to listen to my community and using assessment tools like the windshield survey tool that we use to actually sort of survey our community and find out actually what their needs were. And so now we listen better versus us telling the community what we think they need. It's what the community is telling us what their needs are. And then just the ability of being a good leader and communicating well with the community.
Great, thank you. Can you just describe any programs you're currently implementing in the community, your program's reach as far as how many people you've served, and how fundamental the Community Health Leadership Program was in developing your programs?
Okay, well, there are several programs that our organization has instituted since I was in the Community Health Leadership Program, and which gave me the confidence to truly strike out and work in different arenas. One is working with hospitals in 7 states to increase the designation of baby-friendly hospital initiative. I had the opportunity to work with hospitals in the Southeast, which have the lowest breastfeeding rates, to help to train the nurses and the physicians to be more informed of what's going on with breastfeeding so that mothers can reach their breastfeeding goals. Another program is the Community Transformers, which is a mother-to-mother support group. And we have had the wonderful opportunity to train community transformers in several states also. We have also started to work in the community to do community support gatherings called Blinks, Breastfeeding League and Kindred Settings. And so working with healthcare providers, working with mothers, and also babies in the community to increase breastfeeding rates.
Okay.
Can you imagine Tuskegee, the home of Tuskegee University, the place where John A. Andrew Hospital was the citadel of healthcare, no longer has a hospital. So as mayor of that city, thanks to the Satcher Leadership Institute, it has now empowered me and informed me in terms of what I need to do to work with my local providers to make sure that we once again have 24/7 urgent care. A hospital is our goal, and we now have a federally qualified health center, which, as you know, is really the major strategy for President Obama's healthcare initiative through the federally qualified health centers. We're now in the process of building a new facility with the program we have. But thanks to this Leadership Institute, I now, as not only the mayor, but as a well-informed, trained health advocate, can help make that a reality.
Thank you.
Thank you.
So some of the programs that we've implemented because of the Satcher Health Leadership Institute, the Community Health Leadership Program, we've instituted a new prevention, education, and outreach program called Positively Healthy. And it's for men, MSMs, or men who have sex with men, and HIV. They're HIV positive, and they're not in care, and the importance of getting them back into care, and the opportunity for them to continue being in care, and just really keeping them in a process that they're taking better care of themselves in the community. We've also implemented it's become a national organization, so I'm now the chair of the National Community Centers for Participatory Research Excellence. But that was because I was a part of the Satcher Health Leadership Institute.
Okay.
And so now I'm chairing that. That is a community-based organization that teaches at-risk communities on being a part of research boards in their community, so that research institutions or academic institutions will have to go to a IRB board and actually ask permission, may we do this research in your community?
Exactly.
And it's about educating the at-risk community and how to interact with the academic partner. So I now head that because of Satcher Health.
Okay, great. Thank you.
That's wonderful. I also want to mention that Mayor Ford has played a major role in spearheading the Mayors for Healthy Communities program by making sure that we are able to get in touch with many mayors around the country to participate in this. So thank you, sir, for your leadership in this aspect.
Just an humble servant. I'm here at the studio where the CEO and I met many years ago, and it's interesting to be back here again. But let me just simply say we're delighted as mayors and as other elected and appointed officials because we have the African American Mayors Association, we have the World Conference of Mayors, we have the National Black Caucus of local elected officials. All of us are working together, even the legislators and the county officials, because all of us need to be better informed, better equipped in terms of knowledge before we can be effective leaders and advocates in our community. So thank you. Dr. Satcher, you know, we're so proud of him because he's an Alabama boy. Seriously, born in Alabama and educated in the Hobson City area, so he's a real hero for us. So we want to thank the Morehouse School of Medicine and Dr. Satcher for this fine leadership institute that you've developed. Thank you, for our mayors are very excited about it.
Great discussion. More on the Satcher Health Leadership Institute presents when we return from this break.
More when we continue on Satcher Health Leadership Institute Presents. The mission of the Satcher Health Leadership Institute is to develop a diverse group of exceptional health leaders, advance and support comprehensive health system strategies, and actively promote policies and practices that will reduce and ultimately eliminate disparities in health. The Satcher Health Leadership Institute has 5 divisions that advance behavioral health, sexual health, health promotion and disease prevention, access to healthcare, and health policy initiatives. We develop leaders who can transform their families, communities, schools, work, and healthcare centers to improve health and well-being. We work with individuals, parents, students, schools, places of worship, doctors, communities, media, governments, and organizations to promote transformative leadership, good health, disease prevention, policies and practices that will ultimately eliminate disparities in health. Through partnerships and collaborations, we develop innovative solutions that are meaningful and help to reduce disparities that negatively impact health, well-being, and life expectancy. We seek and appreciate partnerships and treat our partners with respect and civility that results in useful, innovative programs. Our programs include, but are not limited to, leadership programs, postgraduate policy leadership fellowship programs, smart and secure children parent leadership programs, community health leadership programs, community programs, sexual health initiatives, re-entry and reduction of incarceration of Black male initiatives, integration of behavioral health and primary care, quality parenting program, childhood obesity, and community health initiative solutions to address health disparities and promote health equity across lifespans. Visit our website at shli.msm.edu to see how you can partner with us to transform healthy communities.
Welcome back to the Satcher Health Leadership Institute Presents. Today we're discussing the best practices in community health leadership training. Our panelists, I would like you to share your experiences in the community on the challenges and lessons learned while you implemented your programs.
Capacity. We grew extremely fast because of the work that we were doing was so needed in our community, working with young women and helping them to be successful in their breastfeeding goals. And growing as fast as we did, we were being called from several different directions to be on national boards and to do work in the hospitals, to train healthcare professionals in many different states. And we did not have the capacity to do it. And so we actually had to learn how to say no to some opportunities, which was a bit difficult because you really want to reach out and help and work with everyone or as many people as possible. It's difficult in what we were doing initially to find other experts that were willing to take the risk like I did and two other of the founders that work with me to actually stop what they were doing sort of in the corporate world and to come and really fulfill their passion. There are many, many women of color who are experts in this arena, but actually just to take the risk and stop and do this was difficult for them. So that, and also being on the board of national organizations is something that I never had a desire to do. However, as Dr. Ty told me several times in the program, you have to have a seat at the table to make a difference. And what I have said, I've actually expanded that since he told me that so many times when people would act like, I'm actually the only person of color who could do this work. And I'd always encourage them actually to make the table bigger so that we could get more people in. So those are two of the most difficult things for me because I am a worker bee and I wanted to just be out there doing the work. The other thing was advocacy, which was painful. I like to work with mothers. I like to work with babies. And to actually have to advocate with legislature and policies and bills was difficult, but it's something that we were able to do and do successfully several times. And so those things were difficult and challenges, and we did sort of see our way through. And I'm amazed at the fact that we're still standing.
And doing a great job.
Thank you.
For me, 20 years ago, I think, we had a comprehensive health center. We had the John Andrew Hospital. I, at that particular time, had a chance to serve as chair of those two organizations. And then I got out of it, went to the Alabama legislature, became mayor, and I got away from providing health care. But the Satcher Leadership Institute brought me back in. And we had, shall we say, a rude awakening when our John Andrew Hospital closed in Macon County. Tuskegee has always been a citadel for health care. The home of the VA hospital, founded in 1923 as the first black hospital for black veterans. John Andrew Hospital. The university had always played a leadership role. But over the years, it lessened its leadership role in the community. And so the Satcher Institute gave me the mental tools and the educational tools I needed to sit down around the table with the leadership at the university and say, let's work together to reactivate and to get 24/7 health care once again in Macon County and Tuskegee. So that is our goal, overcoming somewhat apathy, because you're always concerned about money. But you shouldn't be concerned about money when it comes to health, because you can't put a price on a life.
Right.
And that's really what it's all about. So this institute has given me the fortitude to dive back in as an elected official, now ready to do what's necessary to make sure that I close these disparities that exist in healthcare in my community.
Great leadership, Mayor Ford.
Thank you.
And to speak to, I like what Mayor Ford just mentioned. One of the challenges for us in developing our programs was, of course, locating funding to support the program. Right. We didn't allow not having the funding to stop us from doing the program. We continued to do the work. And so one of the things I'm learning from Dr. Satcher's office and the Satcher Health Leadership Program is to put tools in our file cabinet, which are often just a toolkit templated grant. Mm-hmm. And so I've learned to put that in my file cabinet. Now I know how to copy and paste. But it's for us, it was a challenge just really locating funding. Right. And I think right now we're so locked into doing the work. Sometimes we forget that we need the funding because we're doing the work. Exactly. But of course, everything needs some money, and you have to locate funding. But I think for us, we enjoy doing the work so much that sometimes we have to go back and go, oh, my goodness, we've got to take care of this over here. Also for us, one of the other challenges was that we couldn't find a lot of resources to support our work, and our work is mostly prevention, education, and outreach. There are not a lot of collaborations. And so we're interested in how to strengthen ourselves as a community-based organization so that we can collaborate with other community-based organizations in our community. And the Satcher Health Leadership Institute, the Community Health Leadership Program, is a part of how we collaborate with other community-based organizations. And so that's part of our strengthening. It has strengthened our capacity as a CBO in the Atlanta metro area.
Wonderful.
How would you describe your ongoing relationship with Morehouse School of Medicine's faculty, staff, in fostering new and existing programs?
Wow.
It's a good one.
I have an amazing ongoing relationship with the Community Health Leadership Program. We actually do a breastfeeding summit every year. And last year we had 264 participants from all over the country that attended. And it was really amazing. And we have it at the Morehouse School of Medicine. The first year, Dr. Satcher was our keynote speaker, which brought people in from all over. And then we've been able to continue to keep their interest because of the venue and because of the history and the reference power that Morehouse School of Medicine has. Their ongoing support would not have been able to do it without that ongoing support at Morehouse School of Medicine. Also, Dr. Ty is on the board of directors for our organization, and I call on him often to just ask questions, for him to calm my nerves. And also, very recently published in a peer review journal, and I talked with him before and after that, because again, that was something that has been pretty much out of my scope of practice. Okay. So I've also had the opportunity to go to places that Dr. Satcher was presenting, just to be there as a community health leadership program alumni, and talk with other people and get them excited about what's going on and wanting to also attend. But there are just, I also have applied for grants and received letters of support, and also just technical assistance to write for those grants. And so, again, it's just ongoing, and it's really wonderful and really needed. I also get to go talk with Dr. Satcher again every now and then for those 15 minutes. And I'm not quite sure if those 15 minutes were supposed to be just the one time while we were in the program, but I have continued my 15 minutes every couple of months, and it's been really wonderful. One of the things that Dr. Satcher told me in my initial 15 minutes was that in order to do all the things that I ran off on my paper to him that I would like to do with the organization, he said, well, you're going to need about $250,000 to do that. And that's not something that I had wrapped my mind around. I had no idea. And so after he sort of said that, right now our organization has gone above and beyond that in the last year, because he sort of gave me a focus.
Okay.
Well, that's great. Nice. That's great. Now, I hope you all don't put me off of this panel because Tuskegee beat Morehouse this weekend. Seriously, I'm gonna
have to look that up.
I know. Divine and Dr. Ty, I tell you, it's just great being associated with Morehouse in any way, both the university, Morehouse College, and of course the School of Medicine. Morehouse School of Medicine, as far as I'm concerned, is the premier HBCU, but it goes beyond that. Premier medical institution of higher learning in the nation, as far as I'm concerned. And for those of us who are mayors and elected officials, and I can speak as the founding chair of the National Policy Alliance as well, for that organization, We embrace and support your mission at Morehouse, and it is an ongoing relationship. Last December, during the kickoff, not only did we have the kickoff of this program, but the World Conference of Mayors convened its annual meeting at the Morehouse School of Medicine at the same time. At the National Policy Alliance, President Obama has asked us to serve as that group which promotes the effort to make sure that African American policy-making organizations have a direct contact with the White House. And he said to us, help us sign up 7 million for the Affordable Care Act. We took that on as a pledge, along with other national organizations, and we were proud to be a part of that. But it is the Morehouse School of Medicine. That is our think tank, our citadel of research and information. At the National Policy Alliance, we have the Joint Center for Political and Economic Studies. Now we have the Morehouse School of Medicine and the Satcher Leadership Institute. This is an ongoing relationship. We want to build on this relationship as elected and appointed officials.
Thank you, Mayor Ford.
Thank you.
Our experience as a community-based organization here in Atlanta, we have taken on really being a part of Satcher Health Leadership Institute, the Community Health Leadership Program, and it's been an honor to access the knowledge and information that's afforded to us as an organization. It actually was an honor. I remember the 15 minutes with Dr. Satcher, and I said, you know, there are other executive directors in my community that would kill for 15 minutes to sit in front of Dr. Satcher and just kind of let go of here where we are. What do we need to be doing? How do we implement programs? How do we develop our programs? And so I respected the time, but I also took advantage of the information and the ability to speak to, you know, persons like Dr. Adekeye, Dr. Ofuku. I hope I said that correctly. But to be able to access persons of knowledge, and that's not always afforded to community-based organizations.
Right.
So the technical assistance and the sharing of information, access to the campus is priceless to a community-based organization. It helps to expand community reach and community programs. And
Thank you very much, Mr. Hopkins. This wraps it up for this episode of the Satcher Health Leadership Institute Presents. I would like to thank our panelists for a thought-provoking discussion and also our viewers. For more information on the Community Health Leadership Program at the Satcher Health Leadership Institute, please visit our website at www.msm.edu/HPDP. Thank you.
Dr. David Satcher is director of the Satcher Health Leadership Institute. Dr. David Satcher is the 16th Surgeon General of the United States. Funding for this program was provided by a grant from the Southwest Hospital and Medical Complex Foundation.